The project was inaugurated by the board chairman of Ubtg, Adedoja Adewolu, who was represented by Professor Ray Ozolwa.
Just to tell Nlng that the board chairman is exceedingly excited that you have done this for Ubtg. Corporate social responsibility, CSR so-called, isn't it? It's not always so easy in coming. We know so. That you have identified with Professor Darlington Obaseki and Ubtg speaks volume. And regarding the person of Professor Darlington Obaseki, there is no one that's in doubt about his stellar performances in the past few years that he has superintended over the affairs of Ubtg. The board chairman again says thank you, Nlng. In another 6 months, that's what Darlington said, says 6 months come around, and you will see that the facility that you have donated will have been put to utmost use, will be optimally used. You'll be delighted. And in the light of that, we are hoping that you will again look back and say, well, we gave you a 15-bed intensive care unit. Now we are going to do something much bigger than that. So if you put $500,000, did I get you right? Yeah. $500,000. We are looking forward to maybe $2 million investment in Ubtg.
An official of the Nlng and the Ubtg said the company, as part of its social corporate responsibilities, has spread the hospital support program to federal teaching hospitals across the 6 geopolitical zone to provide better health care to the people.
It's a resounding one.
He disclosed that after carrying out a thorough need assessment of Ubtg, the organization decided to change the face of the ICU center and as well provide modern facilities that will meet the needs of the people.
Okay, second phase will be anytime from next year, and well, first of all, I haven't successfully completed the first phase and learnings from the first phase. Second phase will have University of Jos Teaching Hospital. I believe that we have Uyo on the list. We have Bauchi also on the list. I will leave it there for now because even for each phase, we take each phase in tranches. So that's what's going to happen. There's a scheme to do 3 monthly review, and of course, by the end of 6 months, we'll come back with a report on what's been done, what's been achieved, how much impact is made. And of course, by the end of 1 year, a full report on all the ones that have been commissioned, so we can focus on lessons that we have learned. And even if we're not necessarily intervening as a follow-up, or to be able to speak to the public, the impact the initiatives have made. We have assurance from the teaching hospitals that they will do a lot in terms of sustainability.
I'm hoping for
the Chief Medical Director of Ubtg, Professor Darlington Obaseki, appreciated the company for their support. He said the upgrade of the ICU center is a product of a partnership that has yielded positive results.
And no, first of all, I think we need to thank Nlng. Like I said, this is what we are hoping for healthcare delivery systems like ours to work directly with sponsors and collaborators, not through third parties directly. This is doubling the capacity of our ability to care for critically ill patients now. We used to have a 7-bed ICU. Now we have an additional 15 beds, which the 7 beds, even this will be fully subscribed, if not oversubscribed. So it's going to, the impact, the lives that will be saved by this project cannot be quantified. We are a government hospital, so our services are highly subsidized by the federal government of Nigeria. So it's going to be affordable, but at the same time, we try to charge enough to maintain the service, to just do cost recovery, not to be able to, no, we're not out for profit, we just want to recover costs so I can provide care for the next patient.
Mr. Charles Epele, Manager Community Relations and Sustainable Development of Nlng, said the project was delivered on record time.
We have set out on a journey with the University of Benin Teaching Hospital, and more are invited to join the train by providing sundry support for that systematic and effective management of facilities and equipment in this intensive care unit.